Imagine a single injection that doesn't just shrink your waistline, but might also protect your heart, your kidneys, and even help you break free from addiction. This isn't science fiction. This is the reality of the most talked about, most controversial, and best-selling drug family on the planet right now: Ozempic, Wegovy, and Mounjaro. In today's video, we're going deep into the full truth behind these injections, the real benefits, the hidden risks, the side effects nobody wants to talk about, and the things your doctor might not have time to explain to you in a 15-minute appointment. If you care about accurate, balanced health information instead of social media hype, stay with me until the end, because this one might genuinely change how you think about modern medicine. Let's start with the basics. Ozempic, Wegovy, and Mounjaro all belong to a class of drugs called GLP-1 receptor agonists. GLP-1 stands for glucagon-like peptide 1. And here's the wild part. It's not some synthetic chemical pulled out of nowhere. It's a hormone your own body already produces naturally every time you eat. This hormone tells your brain, hey, you're full. And it tells your pancreas to release insulin at the right time. These drugs are essentially lab-made copies of that natural hormone, except instead of lasting a few minutes like your body's own version, they're engineered to stay active in your system for days, sometimes even up to a week with a single injection. Here's where the story gets interesting. These drugs weren't originally created for weight loss at all. Ozempic was developed and approved to help people with type 2 diabetes control their blood sugar levels. But during clinical trials, doctors noticed something they weren't even looking for. Patients on the drug were losing significant amounts of weight as a side effect. That observation completely changed the trajectory of an entire industry. Drug companies took the same active ingredient, Semaglutide, increased the dosage, and rebranded it as Wegovy, approved specifically for weight management in people who are overweight or obese. Then came Mounjaro, made by a different company using a slightly different approach. It targets not just one, but two hormone receptors, GLP-1 and GIP, which in some studies has made it even more effective at promoting weight loss than the single hormone drugs. So how does this actually work inside your body? When you inject this medication, it travels to a part of your brain that controls hunger and satiety, basically your appetite control center. The drug essentially convinces your brain that you're full, even when you've eaten less than usual. At the same time, it slows down how quickly food leaves your stomach, which means you feel fuller for longer after a smaller meal. This combination is why people on these medications often report something they've never experienced before, what some call food noise finally going quiet. That constant mental chatter about what to eat next, that craving for snacks, that urge to finish the entire plate. For many users, it simply fades into the background. And it's not willpower. It's biology being reshaped by the drug itself. The clinical trial results have honestly stunned even the researchers who ran them. Some major studies have shown average weight reductions between 10 and 15% of total body weight over the course of about a year and a half of treatment. To put that in perspective, that's a level of weight loss that used to be achievable mainly through invasive bariatric surgery, not a weekly injection you can do at home. It's no surprise then that adoption has exploded. Recent estimates suggest roughly 1 in 5 adults in the United States has used a GLP-1 medication in some form. And usage continues climbing as prices slowly come down and pill versions of these drugs start hitting the market. But here's something most headlines miss. This isn't just a weight loss story anymore. Newer research is uncovering effects that go far beyond the scale. Large cardiovascular trials have shown that these drugs can reduce the risk of heart attacks and strokes in high-risk patients, independent of how much weight someone actually loses. There's growing evidence around kidney protection in people with chronic kidney disease. Researchers are studying its effects on sleep apnea, on joint pain from arthritis due to reduced load on the joints, and perhaps most surprisingly, on addictive behaviors. Some patients report reduced cravings for alcohol, nicotine, and even certain compulsive behaviors unrelated to food entirely. This has led some doctors and researchers to start calling these the first true longevity drugs, not because they directly extend lifespan in a proven way yet, but because of their potential to prevent so many of the chronic diseases that shorten human life in the first place. Now let's get into the part of the story that doesn't get nearly as much airtime: the risks, the side effects, and the things that are easy to gloss over when a drug becomes this trendy. The most common side effects, especially in the first few weeks as your body adjusts, are nausea, vomiting, diarrhea, and constipation. For most people, these are manageable and tend to improve over time. But for a meaningful number of users, they're severe enough to make them stop treatment altogether. Because the drug slows down stomach emptying so dramatically, some patients develop a condition called gastroparesis, where food sits in the stomach far longer than normal, causing persistent bloating, discomfort, and in rare cases, more serious digestive complications. There have also been documented, though relatively uncommon, reports of pancreatitis, a painful and potentially dangerous inflammation of the pancreas in people taking these medications. Then there's the rebound problem, and this is a big one that often gets buried under the success stories. Multiple studies tracking patients after they stop taking these drugs show that a large percentage of the weight comes back, often within a year of discontinuation. This tells us something important. For most people, this isn't a short course of treatment like an antibiotic. It functions more like a chronic medication, similar to something you take for high blood pressure or diabetes, meaning you may need to stay on it indefinitely to maintain results. And that completely changes the cost conversation. If insurance doesn't cover it, and in many countries it doesn't, we're talking about an ongoing monthly expense that can run into hundreds of dollars for years, possibly for the rest of someone's life. That's a financial commitment most marketing campaigns conveniently leave out of the picture. There's also a less discussed physical concern. When people lose weight rapidly on these medications without adequate protein intake or resistance exercise, a noticeable portion of that weight loss can come from muscle mass, not just fat. Losing muscle isn't just a cosmetic issue. It can slow your metabolism, weaken your body, and increase frailty, especially in older adults. This is exactly why more responsible prescribing now comes paired with nutritional guidance and strength training recommendations, rather than treating the injection as a standalone miracle fix. Another point worth sitting with is simply this: these drugs are still relatively new on a mass scale. We have a few years of solid data, not multiple decades. Some animal studies have shown a link to a specific type of thyroid tumor, which is why these medications carry a boxed warning and aren't recommended for people with certain thyroid cancer histories or family histories. Whether this risk translates meaningfully to humans at the doses being used is still being studied, and that uncertainty itself is worth knowing about before anyone jumps in. And then there's the trend that genuinely worries a lot of medical professionals: the rise of people sourcing these medications without proper medical supervision, often through unregulated online sellers, compounding pharmacies of questionable quality, or social media sellers promising fast results. Because demand has outpaced supply for years, counterfeit and improperly dosed versions have shown up in various markets, and self-administering an unsupervised, unverified product carries real danger. This is a medication that's meant to be started at a low dose, increased gradually under medical guidance, and monitored for side effects, not something to treat casually because an influencer made it look easy. So where does this leave us? Is this drug the medical breakthrough of the decade, or an overhyped trend riding a wave of social media buzz? Honestly, the truthful answer sits somewhere in between, and it depends entirely on who's asking. For people genuinely struggling with obesity, type 2 diabetes, or related metabolic conditions, under the care of a qualified doctor, the evidence for meaningful, life-changing benefit is strong and growing stronger every year. But for someone chasing a quick cosmetic fix without medical need, without supervision, and without understanding the long-term commitment involved, the risk-to-benefit equation looks very different. Like every powerful medication in history, this isn't a simple good or bad story. It's a tool. And like any tool, its value depends entirely on how, why, and under whose guidance it's used. If you or someone you know is considering this path, the single most important step is having an honest conversation with a qualified healthcare provider who knows your full medical history, not a stranger online or a viral video, including this one. This video was made purely for educational awareness and is not medical advice. If you found this breakdown genuinely useful, hit that like button. Subscribe for more deep dives into the health trends actually shaping our world right now. And drop a comment below. Do you think GLP-1 drugs are the future of preventive medicine, or just another trend that fades with time? I'll see you in the next video. Take care of yourselves.